This book, Rebooting of the Brain, is possibly one of the finest written books on this subject. And it is very close to all the neurosurgeon heart of fools in this world. Firstly, those who give an advice, those who don't take it. When a person comes with an accident, doesn't wear a helmet or something, we tell them, please helmet, please. Now what we do, negative feedback. Nodri, helmet ಹಾಕೋಬೇಡ್ರಿ, ಜಾಸ್ತಿ ಕುಡೀರಿ, ತಲೆ ಏಟ್ ಆದರೆ ನಮಗೂ ನಿಮಗೂ ದುಡ್ಡು ಬರುತ್ತೆ. So,
hello sir.
Good morning. I am Dr. Ramesh, neurosurgeon. I know Dr. Sharan since the last at least 20 years. And from the last 8 to 9 years, I have been associated with him at the Jain Hospital, Girinagar, and his PRS Neurosciences. And we have interacted very closely with him for a good number of patients which I treat, and have seen his colleagues and team also working.
Right.
This book, Rebooting of the Brain, is possibly one of the finest written books on this subject. And it is very close to all the neurosurgeon heart for the simple reason that all of us in neurosurgery face exactly the same challenges in managing all the patients he has described, whether it is trauma, whether it is stroke, whether it is a patient of Parkinsonism, and we suffer exactly the same challenges in treating these patients. 15 to 20 years ago, when we started our careers, neuro-rehabilitation was not known to anyone in India. It is only in the last 10 years that neuro-rehabilitation has come to the forefront, and it is people like Dr. Sharan and his PRS team which has brought neuro-rehabilitation from the textbooks to the forefront of management. It is like the Baba Ramdev moment. It required Baba Ramdev to get yoga into the world and into the country, as complicated as it is, into the forefront of common man. So I think what Dr. Sharan has done is to bring as complex an issue as neuro-rehabilitation, management of functional disorders, into the realm of common man and common neurosciences. On a daily basis, I have seen Dr. Sharan's team at very close quarters, the dedication, the compassion and the empathy they show to these patients. And these patients are very difficult to manage because all of them are unconscious. They cannot speak to us. To manage an unconscious patient is a very difficult task. It's a very challenging thing, which requires a lot of dedication and empathy. The classical case he has described here in this book is one Mr. Rajiv Jambu Rao. Possibly this patient is a test case for all of us in neurosurgery. I was walking in my apartment on a particular fateful day, as we all walk. I get a call from one of my neighbors that a man middle-aged man who has just walked in from his haircut salon, goes into the bathroom and he is found deeply comatose. Perfectly healthy individual. I rush up, distraught relatives, family full of doctors, and an unconscious middle-aged person lying in the bathroom. It took me at least 2 to 3 minutes to recollect my thought. Even though we neurosurgeons deal with these patients every day, but it is not often you are called to see a patient unconscious in the bathroom of their own house. It took me a few minutes to recollect my thoughts, arrange an ambulance, take him to Vasavi Hospital, Super Specialty Hospital. He had a massive left-sided stroke on the brain. And this is a perfectly healthy individual with no comorbidities. Middle-aged person with no morbidities, and he has just walked right in front of me, I was told, to go to his house to have his bath. I don't know who this gentleman is. It took about 1.5 months to treat him. The next 2 years, he underwent neuro-rehabilitation. It is to the credit of his wife and family who took up the challenge of neuro-rehabilitation. See, they have to come out of the trauma of what has happened. His son was reading for NEET, had to skip because he could not see what had happened to his father. So, a budding doctor changed over to engineering. But 2 years, they rehabilitated him. Today, he comes to meet Dr. Sharan and team driving his own car. And when you see him, you do not know what the person has gone through. So that is what, and it is Dr. Sharan has brought out so many more patients, how challenging they are in our profession. So I think every single person who is in neurosciences directly should read it. Very lucid, very simple and very heart touching. And that you cannot say about many books.
That's also the key. Who do you think should read this book? Is it just for the doctors, just for medical professionals, or?
Every common man should read it because it shows things which are very commonly seen. The problem what has happened in our country, as he has shown, road traffic accidents, India is the accident capital of the world. 2 lakh people are dying every year. 10 lakh people are disabled for life in this country. And 50% have died even before they reach hospital. I do not know whether you saw Nitin Gadkari's interview the other day in Aapki Adalat. He has given India in 10 years some of the best highways. But he was in tears to say that I am not able to prevent deaths on Indian roads. And unfortunately, the RTO of this country is responsible for half the problems. And he tells us on the TV that he has a chief minister's driver who has both no eyes, but he drives his car only by noise. आवाज से गाड़ी चलाता है. So it was so shocking to hear that there is a chief minister's driver who is totally blind. He has a license given by an RTO and he drives the vehicle only by आवाज, by the noise. That is the state of affairs we are in this country. And that is what Dr. Sharan has touched. Bandle helmet. He talks about the curry helmet is basically what is called Bandle helmet. It has no purpose for head. It has no purpose for security. It has no value.
It just saves you from the fine.
And I have seen 90% of law and order policemen, they never strap their helmet. The traffic policemen may strap, but law and order, they never. This is the unfortunate part. But what to do? How many people can we save in the world? How many people can we save? We can only do what is there. See, that's what when Sai Baba in his younger childhood was walking on the beach, he was picking up jellyfish on the beach and trying to save each of the jellyfish going on his feet. So someone asked him, are you going to save all these jellyfish? He picked up one and said, I'm only trying to make a difference for that jellyfish. Maybe that is how all of us are.
Other than the book, you are a senior neurosurgeon. We would love to have a small bit as a piece of advice that you would like to give the viewers.
Okay.
It doesn't have to be about the book, just in general.
See, there are only 2 types of fools in this world. Firstly, those who give an advice, those who don't take it. And I have tried 30 years to convince people to wear helmet and seat belt. It has never worked. Now, we have started doing negative feedback. I don't know whether you know what is positive feedback and negative. Yeah. When a person comes with an accident, doesn't wear a helmet or something, we tell them, please helmet, please. Now what we do, negative feedback. Nodri, helmet hakobedri. ಜಾಸ್ತಿ ಕುಡಿರಿ ತಲೆ ಏಟಾದರೆ ನಮಗೂ ನಿಮಗೂ ದುಡ್ಡು ಬರುತ್ತೆ. This is called negative feedback. I think the same thing we had to say. And I had interviewed a traffic DCP in Mysore when I was there. He told me one simple thing. Traffic policeman job in India is like a sweeper job. You sweep all the garbage till 10 p.m. Next day you have exactly the same amount of garbage. It will never be solved. So I cannot give advice to anyone because I don't think anyone is going to follow it. That's the way we are.
Thank you so much for making time.